Otherwise, because sometimes it's all depends on their practice. I'm not like this. What I'm doing only I'm getting good result from this. Someone is practice from different method. They also get good result. Understand? What I am discussing, this is all my practical experience. This is not like this only I will get the result. This is the basic fundamental. If anyone will do this treatment, they will get good result. Because on diagnosis, treatment is more clear and a little bit more in depth. Before I practiced in the TCM, like for a long time, I was not comfortable with fixed protocols. So that's why. Still, if you see like Anton Jesria book, he's having like fixed protocol, and there are 2-3 more books. They also have like fixed protocol, which is main books. But I mostly believe more go on the pulse, try to find out the root, go on the tongue, what is imbalance, vata imbalance, then use only vata point. Okay. If there is vata imbalance, if I am going to use the different points, then maybe that will respond or not that much. Okay, we are almost, now we are done with the crack one. Okay, crack and contraction is only measure. Not contraction, crack is more measure. You will not find many these terms like color. There will be you will find the color only on the liver, spleen, heart. Okay, the maximum coated, just white coated, yellow coated. Okay, crack is vata is giving lots of the problems.
You know the You know the transverse cracks of the picture you showed us. Does that mean like the kidney, the liver, the lungs, all of them are dry?
All are there?
Yeah, because the cracks are going through all of those parts of the tongue. Or does it have to be horizontal, or sorry, vertical when it's left kidney? It can't be transverse, or it can't be horizontal.
Crack in left kidney?
Yeah.
I have more than like 9,000-10,000 tongue. I have not find any crack in my left kidney.
Okay, but so for that, when it's the transverse cracks, it's only referring to
mostly transverse crack you will find only in the liver and the spleen and sometimes in the center of the tongue.
Okay, but that picture you showed us had cracks all sides.
So if you see the major part of the crack,
okay,
slowly, the tongue also is one muscles, no?
Yeah.
So slowly the dryness is increasing the muscles. That's not the major part.
Okay.
Where is the more like the crack, the depth?
Okay.
That is the only exactly part.
Can we see dialysis, anything like that on the kidney? If there's some dialysis or something.
In the kidney, the major issues happen. That is the contraction. In the kidney, the contracted kidney will happen more. Okay? When we will come on the kidney, this kidney is more contracting.
Okay.
Recheck this transverse crack on your liver and spleen. Understand?
Yeah.
Divide the tongue in 3 parts and see where is the more crack. It's come little bit on the more circulatory organ, but maximum on the your producer organ.
There's contraction as well, no? Like on the right.
The small contraction.
Yeah.
When tongue is cracking,
It's
okay,
gonna
some muscle
contract.
will contract that side because tongue is cracking. Of course, this tissue will move somewhere.
Okay. Yeah.
Okay. Some tongue is contracting. When the tongue is contracting, this was the tongue contracting. They are cracking the tissue, right? And after cracking the tissue will move somewhere.
Okay.
This will come maybe this side,
Yeah,
this
so
side.
it will
there-
look like contraction.
Yeah, that's the normal. Now we'll discuss with the contracted term. If you want, you can give mild superficially moksha all the correct time. All the correct time. If you want to give mild superficially moksha. That's enough. Otherwise, if you are not giving moksha, that's enough. Vata is, the
Vata is dry
vata
anyway.
is already dry and very sensitive. Just needle stimulation is enough.
How many minutes? All protocols 15 minutes, 15 to 20 minutes.
Yeah, 10 to 15, 15 to 20. See, sometimes after the treatment, is patient is getting discomfort. You can take out needle around 10 minutes also. Sometimes patient leaves sleep, so there is not fixed time like you can keep only 10 minutes or 15 minutes. You can give 5-10 minutes extra. Okay, it depends on how their body is responding and receiving the treatment.
And maybe is it we keep it for more time so it works more, or it has done till that time?
No, it's not like this. After maybe 10-12 minutes, that's done.
Work is done.
It depends on sensation. And you insert 5-10 10 minutes, 12 minutes, the needle is still giving the sensations to body. If you are feeling a little bit discomfort with needle, no. After that, we'll make the habit so that is not that much of a sensation. Okay.
Now we will contract.
Yeah, now we'll start the contracted one. So, I think first we start from the heart. This is very major issues in the heart and contraction. Can you see this term? This is the contraction on your pericardium.
Yeah.
Okay. Whenever tongue will contract on pericardium, tongue will contract like it's called like hematome.
Or it is like this.
Yeah.
Or else going like this.
It's not going like that. Tongue is only like this.
And
तो कभी नीचे नहीं जा रही है, कभी आगे से ऐसे एकदम शार्प हो गई है, टिश्यू जो है बस आगे तक ब्रेक हो गई है. Because always remember, when there is contraction on the side of the tongue or tip of the tongue, the tongue will not go deep. The tongue will contract toward the tissue. Correct? If tongue is like contracted from here, then this contraction will go this side. Contraction here, then contraction will go toward of the tissue only. Contracted here, then it will go toward of the tissue, and that's why tongue become broad now. Okay? But if tongue is contracted in the center, then it will go deep. Got it? This is the for your pericardium, and this is your heart. So heart is little bit backside the pericardium. Heart is not on tip, right?
Yeah.
Heart is little bit backside, so that's why the tissues went deep. Okay? This is the heart.
Like a depression in the tongue. My balance is like
tongue is moving, that is a different diagnosis, okay? Tongue is moving somewhere, that is the gray matter, white matter is going to blocking some artery, some nerve system. We'll discuss about that. The contraction of tongue, contraction of the tongue is different, but tongue is moving sometimes a little bit on left side, right side, upward, downward. That patient, CO2 patient, you see his tongue is really moving upward. Okay, so that is a different diagnosis. Contracting tongue is completely different. Okay, let's start with contracted tongue. Contracted tongue is the first symptom will be suppressed emotions. What?
Suppressed emotions.
The contracted tongue on the heart is suppressed emotions.
This is the pericardium or heart or both?
The heart. Okay.
For the this part.
Yeah, on a little bit back side because I saw the heart tongue.
Yeah. Heart is very good.
In emotions level, mostly pericardium and heart both are functioning together. On emotions level, we don't have the separate emotions for pericardium and heart.
Yeah, it's the same.
Okay, the emotion is the same. Somewhere we divide the pericardium function and heart function, but in somewhere they both are functioning together. For example, the circulations of the inside the heart and pericardium is different. What we have circulation in the heart, the blood circulations, and what we have the circulation in the pericardium, fluid circulations. Within the one organ, the same organ is doing the two different functions. Same like the spleen. The inner part of the spleen is functioning on the red blood cell and white blood cell, and outside the spleen that is functioning more on the
Red.
yeah. So exactly like same in pericardium. Okay, in pericardium the fluid circulations, and inside the heart that is more blood circulations. Okay. So when we are talking about the heart contraction, that means that some of the emotion suppressed. They don't want to let it go, or they don't want to share that information with anyone. I'm not talking about trauma, okay? Trauma will be a little different. There is some emotions. For example, I am a little bit disappointed with you. I don't want to tell you why. I just keep in my heart and I will suppress, and like whenever I talk to you, my language will be a little bit different. Okay, what you ask, and I am just going to release my emotion from a different way, not directly. What you ask and what I am replying. Okay, that means I am just releasing my emotions. I am not answering your questions. Sometimes this happens when we are talking with someone, and for example, you are angry with me. Someone asks something, I asked you, why I should tell you? Then going round. What is the situation? Not going directly.
So they're saying, they say, if you've nothing good to say, don't say anything. That's actually not good.
No, if you are like having with some
Issue with
issues,
someone, you should tell them.
talk it. Okay, but if it's not affecting you, for example, if one kapha people and one vata people, so when vata people is doing lots of like this, kapha people don't mind that. If the vata people is saying anything, kapha people know, oh, he's only like this only. He's not getting affect himself. But sometimes, for example, they both are there some little bit of like deep situations. Okay, for example, between the partners, and one partner is getting very, very hard, and another one is we don't realize even. They said, I don't want to say anything. That's the different thing. When you are suppressing something and really affecting on your emotion, the best thing to say. Understand?
Yeah.
there is a contraction, smile, contraction on your heart, they will get effect from the many things. Always they will get effect. So their partner will be not able to answer for all that emotional situations. For example, when this part is like contracted, this is not acute problem, right? This is not suppressed through just one situation. It comes from the long time. Okay? I want to say, but I don't want to say, I'm just holding, I don't want to say anything. Then if any like situation come, they are just holding, they don't want to say. Okay? Then what will happen when they learn to hold anything? In some, for example, some conversations you did some mistake and I get effect, but you don't realize that. Understand? And I am holding, now I am very angry with you, I hate you, and like this all, I am holding that. When you discuss with me, everything is sure. Next day it's happened again the same. Because we taught our muscles and organ only that to hold the emotion. Okay? So we will start to get from the small problems. Okay? When I am getting the create the small problem, we are going to explain each and every problem. Oh my God, this is the never end. Because you are expecting from the small thing and how I can clarify that all thing. Okay? So this is a little bit difficult case. The one of the best thing what I saw in this case, the people who play the role, they are very sweet.
They have a lot of suppressed emotion.
Yeah. I have 3-4 friends. I think just if friend like one or this friend like only this type of the one friend, yeah, they'll fuck your life. But so think in my life I had 3-4 friends. Okay, so they have a different. She said this, I don't like that. He said this, and I am the center. Please do this. Say sorry. Then after 10 steps, again same situation happened. Then we decide we don't go on the track from today. 1 month, and they all become close. We have to go and they are good friends. And when I am in the middle to solving the problems, they are creating more problems. When I came out, everything is good. Because they need more attention. They don't like each other. If they create problems, then I am here to solve the problems. But when there is no one to solve the problems, if you both are living together, then what will happen? You have to shake your head, otherwise there is no option. You will fight. Who will come and say, okay, don't fight? This happens with each and every group. It's very good when you're going somewhere with a group and try to find a psychology. Okay? We have a game, so we play game here. You came there, right? In that game we have like 10-15 people and from different countries. So they are like just 2-3 people who is just disturbing the whole group. Okay? From the useless topic, which is like not related to the practical, but still they enjoy. Understand? Because this case slowly convert in a little bit of the like terminator and sadistic behavior. Okay, in this condition, unconsciously they create the problem. Okay, in masochistic, what happened? There is crack tongue. No, they love to take problem. Why you are so okay? You don't have money, just take this money. Okay, you want to go Mapsa? Let's come. I'll drop you. Okay, and if there is little bit contractions, they will love to create the problems. But some cases like this, their tongue is contractor, but their family is very good. They are sharing, they are doing everything. Their family is very good, so they don't have more emotional issues. If their friend circle and family is good, no, then they don't have any emotional issues or any types of the issues.
They're being supported.
Yeah, because they are supporting. Okay. So when there is contracted tongue, the what happen? When you hold your emotion, your brain is giving the signals, but your heart don't want to receive that signal. It's just reflexing from here. Then your brain will try to give more signal. Understand? When the heart is not, the brain is not receiving the signal, then heart will think what happened here, trying to give the more symptoms. Okay? In this is very one interesting that I just show you. For example, in some country, for example, let's think about India. In Rajasthan here, there is one like army, what we call the army office on the border.
Okay.
There is some
Soldiers.
soldier का team को, soldier team, and one team is here, okay, and one team is here. There are the three teams, and here is Delhi, okay, and Delhi is like brain, and this three border army, these are like part of the body, okay. So this is the heart, this is the liver, and this is the lungs, okay. Now what happened? Some army fight start some war, and they report to brain there is attack. They just said only this, and we need backup. And they now cut down their phone. Maybe signal is not there, and they are trying to contact these people constantly. Call. Oh, there's no signal. There's no signal. They are trying to connect with this part more. They are sending lots of the signals, but they are not responding. Whenever they are not responding, then your brain become more. Yeah, the capital Delhi. All the ministers become like, what will happen now? What will happen now? They are not receiving our signal. They are not responding. They are not responding. Then what will they do? They will send the signal to the neighbor one, who is directly connected with that. Okay, so there is attack. Be alert and please send some armies to check what's wrong going with that. Please send some army what's wrong going with that. Now these two organs become the masochist. This organ become the sadistic, means not responding, and these two organs become the axis. One ready to fight with enemy here, second army is going there, and this army is saying, what will happen if we will go there? There are many people, there are many enemies, then what will do? So that's why it's called, when your one organ becomes the sadistic. Sadistic means not sadistic. Simple definition is not enough signal from organ to brain. Understand? So in this condition, they will create a 3-4 masochist. Means they will create a hyperactive different 2-3 organ. So now you are going to, and hyperactive organ will give you more symptoms. Okay? Now when you are give the treatment, where you find more symptom? In the liver, in the lungs, this whole area. You are giving the treatment to liver. Liver, please don't be more hyper. Relax your body. This happens no, when you are suppressing your emotions, you become more angry. You are having the breathless issues. It's happened mostly. Okay? You are saying to liver, please don't be angry. And lungs, please wake up. Inhale, exhale. Right? But they are saying, I am angry, I am hyperactive to save your life. Okay? If I will be not angry, then who will give the signal to your heart? Understand? Then they are like this, and when we will touch needle here, on the heart, there is one signal. When we insert the needle on the heart, give the signal, and that signal is going to the minister office, to your brain. How signal? One signal, hello, can you hear me? And they say, oh yeah, there is signal with the station. Oh, there is signal, they are alive. And they are again connecting with their signals. Then these two become the calm down and normal. Because why they were active? Because of this person. Now this person is responding, they say, fuck you, you don't need your signal now. They will go back. That's why we give the cardiac exercise when there is contraction on the heart. When the heart is contracted, so what we are giving, we are trying to give the cardiac exercise. Cardiac exercise help in 3 ways. One, creating the pressure and giving the resonance to brain. Okay. Second, the releasing the steep muscles in your muscles in your heart. And third one, we are creating the resonance inside the pericardium. Okay. Pericardium help a lot for signals too. Understand? So with one pericardium mostly we give when heart is contracted. You don't need to give pericardium when there is tongue crack. Okay?
So that's why in other language medically also, if you relate, when they say you watch out your emotion, let it go and all, this is actually if you say it's this only, no, that you release that. So
See,
it
let
gets back to
let it go emotions is not that easy. To explain someone, to say someone just call me one very big doctor. Just he called me, I am the doctor, I have no physical symptom, I heard lots of you about you, you are solving some emotional problems. I am here in Goa and I had just breakup and I don't want any medicine, please doctor, I am coming to you. Okay, come, do some treatment. Okay, so for example, I had many patients who is like psychologist. Okay, it's little bit insecurity when we are giving using their name. For example, if she came, she is the doctor, she came, he said, okay, she is doctor and she came to me and for the treatment. Why I am talking like this? To increase my value, how big I am. So we are just friends, we are sharing information, we are learning, so that's not the issue. Friend of the patient, these are the patient. Friend of the patient, see, this is the doctor from that hospital comes to me for the treatment. This is the like types of the insecurity. Do not talk anything friend of the patient to about the patient. Okay? See, this is the patient like this. Sometimes you can give a good example, like patient was not able to walk and now he's walking. That is a good example. You are giving the motivation to the patient. Okay, but he's the doctor, but it's allopathic, but he's still coming to the acupuncture. So what? You also sometimes going for allopathy. So do not share the patient's information to patients. Maximum time when I do the tongue diagnosis, for example, now you are learning. If you have got 2-3 students to on the patient, okay, show me your tongue. Okay, see that it is hard. Next one, there is kidney. What's wrong going on here? Okay.
It's hard when you're learning though, like we're only starting, you know.
Yeah, of course this. But the best thing when you are discussing only one patient and one student, they are more comfortable with you, and you will get more confidence.
But you're less comfortable
Okay.
because you don't have backup.
Now the backup will come through your picture. When you click the picture, will come on the side. We'll talk about that. The other thing, just take the picture, come side. We'll discuss about that. Then go back to patients and start your discussion. Okay, and sometimes when you are 2-3 people and you are asking, okay, you had breakup. No. Okay. Oh, you are like that. No. Who want to share their personal information? Yeah, no one want to share their personal information. When they are comfortable with you, okay, let's go, let me start. Okay, you know your heart is little bit contracted. So do you have any like emotional issues which you are still holding or like this? Give them like comfortable zone. The best thing which is the comfort zone. I had mild breakup. Okay, do not attack anything which is really trigger you. Okay. So go a little bit like there is one example now like if the boys do the mistake, the boys will go to the girls, I am sorry. And when girls is doing the like mistake, that's just joke, don't mind, okay? And when girls is doing the mistake, to say sorry, they will go like this. round, end of the movement. Okay, it's not my problem, but sorry. So always go like this. Okay, do not target directly. Okay, so always go like this. Then slowly, person will take you in their own emotional journey. See, this is my journey. From here, everything will start. Unconsciously sometimes they don't know even from where it comes. When they are discussing, then you will reach in this point. But trust me, in the starting practice, go with questions answer. Do not point directly, you have these problems. Go with questions. Okay, I can see there is mild contraction on the heart. Okay, when the heart is contracted, you had some emotional issues in your past which you holding, and there is some types of the informations you don't want to share with anyone, and you have a little bit of the trust issues too. When his heart is contracted, they have a little bit trust issues. You have the trust issues. Why do you have that? Okay, then they will talk. I had these. Trust me. you have to learn little bit of the patience. Sometimes when the patient is start, you need 5-6 cup of the tea. They talk a lot about, but that's the good thing. They are going to release, respect their emotions, respect their healing process. That is part of the healing. Okay. After that, you don't need many needle. 50% they already they release their anything. What do you have to figure out? Where is the problem? Never ever support the patient's emotions. Oh, you are the right, the boy was wrong. Okay? Or you are the right, the girl was wrong. No. Or never ever go against that oppositions, okay, against the patients. Try to figure out the situations. Okay? Give you the example on the situations. Maybe your nature is not matching, but everyone are not same. Okay? What you don't like him, maybe he don't like in something in you, because of the understanding is not that much. One person is like this vata, you can give the vata example, kapha example. One person is energy is very high level, another one is low level. He is thinking you are the very lazy, and this person is thinking you are the very hyper.
Now, if it is the Vata patient, he will say the doctor is mad.
It depends on how you are doing the consultation. Okay? Okay. From today evening, if you find some patients, please start with consultations. You can take in the here, you can go outside, take them to chair. Okay. Before I used to do sessions like, if there is a psychology consultation, I used to go in the cafe. Okay, I say you will order, I will order, you will pay the bill. Okay, so this Jackfruit Cafe, Mojigal, it was a very good cafe. We go there and we start consultations. So it's going long time, 1 hour, 2 hour, like this. Okay, but whenever, for example, if you are sitting on the bed and 1 hour consultation, of course I will come. Oh, please, what are you doing? Patient is waiting for bed. Okay, whenever you are doing the consultation, take the chair or not front of the many people. And never ever disturb to anyone. Whenever doing the consultation, don't go and ask anything. Okay, can I do this? Can I do? No. Do not break the chain. Once you break chain, it takes long struggle to come back on the same point. That's why whenever someone is doing even the muscle testing, nadi, just normal questions answer. For example, what I do, like Khushi went to ask the patient, what is your problem? Okay, she already discussed with patients. Now she is little bit confused and she wants my help. So I will not go and ask what is your problems. She will tell me, and I will start with consultations where she end. Okay, like she did like 6 months before I had a slip disc and still I am having the pain. And so she come and give this only this information to me. Okay, so the pain is radiating on the left side or the right side? I didn't ask when did it start, okay, what, and they start from the, like, on the left side or right side. And if she didn't ask in which vertebral column, I will ask you had any MRI or you did any MRI or in which vertebral column you removed? No. Then I will be there. Got it? So whenever you are doing consulting, take your time. Doesn't matter how many patients are waiting for you. Okay? It's not that important how many patients you are treating a day. Okay? It's important how deep you went with one patient. That's the more important. This speed fast, like what I'm doing, that is, I don't think the good thing. I'm never proud for this. I'm treating every day 50 patients. No. Anyone can treat. Many people are doing the camp, they are treating 2 to 100 patients. With one patient, what, how much deep you went, what was the result of that, what is the essence of that, what you understand the patient's history, that will teach you more deep. That will guide you more deep. I just set up this history because I want to start again, because even in clinic charity, I will give to the student, there are 1-2 senior students coming back, I'll handle them, we will just handle this clinic. I will start my profession again after 2-3 years. So I said to my everything, I'll put the back side of the patient camera here. The patient is there is camera and the mic to the patients, and we do not show the patient face. Okay, and I start proper consulting. And I will try to share that all information on YouTube or to my students and so how we are doing consultations, the flow, the lead, and what we do to treatment for this, and after many sessions, how patients forth, different, consulting pure diagnosis, and tongue before tongues and after tongue. For this you can charge extra, you can charge 3,000 for example, 1,000 for treatment, the first consultation is 4,000, like 2,000, 3,000, because you are giving that much time. And trust me, if you are doing consulting like this, no one will say no for that much of the price. Because what we are doing now, I visited many psychologists and they are not going that deep. They are just believe on mostly on top of their report, which hormone is imbalance, which vitamins, mineral is imbalance. Okay, what they do the emotions diagnosis? Is there any emotions diagnosis? They connect emotions with the chemicals, right? This hormone is imbalance, that's why you have this emotions issue.
Yeah.
In psychology, but psychotherapy they do. Psychotherapy they do. They link it all to childhood.
No, I'll say, I visited many, they are doing the consulting diagnosis only. Out of these, what is the next diagnosis for psychologist? Is there any physical test? For emotion there is no test, no. Test is only for the
They might
material
check
things.
their gut bacteria or something like that. They might check their gut bacteria.
Arre Baba, this is the emotion, this is the emotion, and this is the same. Okay? If this emotion is affecting this cell, okay? Both are internally connected. Emotion is affecting cell and cell is affecting emotion. Whenever you are emotionally imbalanced, of course your cell is imbalanced.
Yeah.
When you diagnose it, you will diagnose for the cell only, no? In the old pathological lab or any kind of test, we do the test for the cell. But for emotion, just there is consultation.
Okay.
Can you measure your emotions level with any emotions? For the emotions, okay?
I know what you're saying.
Yeah, for emotions, we do only consultations. What is the problem actually? If we fix the emotion, this one, of course our cell become normal. But in maximum time, what happens? If I give some medication to balance this cell, okay? In that condition, also your emotions become balanced. But when under the same situation will come, and they affect the emotion, again your cell become imbalanced. But once if we fix this emotion, then this will not affect again cell.
Okay.
Got it? So
Yeah.
that's why I said any kind of the types of like emotional and psychological issues, the consultation is more important to go in the depth. For that, our tongue is helping us, and your pulse will help a lot from where you will start the consultations, and what point you can start, and you can help two patients find out what will be root cause, which organ is affect first, then second, then this maybe you have in your life happened some situation like this. They said yes. Do you have any relationship issues with your mamas from childhood? Then they said yes. So that's why you have issues with your partner. There is some different this type of the psychological consultations.
We're
Okay.
gonna learn that.
Huh?
We're gonna learn that. We're gonna learn that.
Yeah. That is only psychological acupuncture, no? So through that we start the consultations. That's why what I say, if you are doing the psychological acupuncture, so the session will be not that much important if you are not doing consultations. You are treating same. You are going to fix this same, and you are trying to fix everything. But even patients don't know what's going wrong. What's going in my body. So that's why I use the sloka. Manushoy Gyan Vigyan Dharya Samarthi Samadhi means when you have some emotional issues, try to realize the patient from where the issues is coming, why this is the coming. When patient understand the situation, then everything becomes normal. Okay, but to heal to that proper damaged body, we'll do some acupuncture session, and for your pocket money also. Okay.